Hello and welcome, it's Chris from Christopher Hall Training, and welcome to this week's tutorial, which is should I increase my spine rotation to reduce my low back pain? Now, this may give some short-term relief to lower back pain, but for the long term, it's slightly more counterproductive. And as you can see from the picture on the right-hand side, this is the type of position or stretch that people will go into to try and relieve their lower back pain. But as I mentioned, this is more of a short-term relief rather than a long-term solution. So what we're going to talk about is essentially, why is rotation a problem? So that's the first thing we're going to look at, and then we're going to look at some things that you can start doing to help your lower back pain without rotating the spine. Before we get into that, I just quickly want to mention you can see my social media up in the top right hand corner. So you've got Twitter, Facebook, Instagram, YouTube. So please do go along to any of those, like, follow, subscribe. It'd be great to have any of you there. Alternatively, pop any comments, questions or feedback in the comments section below. It'd be great to hear what you have to say. And finally, if you are struggling with lower back pain and you do need some help, then I do offer a remote low back pain consultation, which involves a questionnaire, a consultation, and an online self-assessment. Once you've completed all of those, I will then put together advice, recommendations, exercises, stretches, everyday activities into a pack for you, and then send that to you, and then we'll follow up 1 week later or 2 weeks later, depending on schedules, and then we will review and update. So if that sounds of interest to you, then please do pop along to that URL. It will be in the description, and we can get started on the road to overcoming your lower back pain. So back to today's tutorial. We are looking at, should I increase my spine rotation to reduce my lower back pain? Well, according to Stuart McGill, many therapy approaches have the objective of strengthening muscles and increasing spine range of motion. This is problematic, since those that have more motion in their backs have a greater risk of future back troubles. So what we're saying there is trying to create more flexibility than one needs is going to be problematic. So if you already have a flexible spine and you have back pain, don't try and make it any more flexible. If you have complete stiffness of the lower back of the spine, then we're going to look at some solutions on the next slide that you can start doing to help overcome and improve the flexibility of your spine without stretching it. Secondly, rotation or twisting of the spine affects the discs and facet joints. Twisting causes the concentric rings of the annulus to slowly separate or delaminate, allowing circumferential openings for nuclear material to traverse through. So what that basically means is your disc or the outside of your disc is like the rings of a tree, and then the inside of the disc there's a jelly fluid or a jelly-like fluid. So as we are twisting and rotating the spine, the rings that are on the outside of the disc begin to separate and begin to allow gaps for this jelly-like fluid to start moving through. Now, this is not advantageous for your spine. So this again is something that we want to try and minimize. We might not possibly be able to avoid it, but we do want to certainly minimize it. Now, with all of this said, if you are in everyday life and you are rotating your spine, this type of thing is fine because it's everyday movement. What we don't want to be doing is enhancing that with exercises and stretches to try and strengthen those planes of movement. What we want to be doing is adding to our low back bank account by doing more advantageous things, which is what we're going to talk about on the next slide. But what we want to be trying to avoid and taking away from our lower back pain bank account, if you will, is these types of stretches that you can see on the right hand side. So what can you start doing? Well, first of all, you need to understand what's causing your lower back pain. Is it the stiffness in your spine? Is it the postures that you're in? Is it the movements that you're doing? Is it the loads that you're exposing your back to? If you can understand what's causing your lower back pain, that will help direct how you solve and overcome your lower back pain. So that's probably the most important point and the starting block to all of this. That is why I have my low back pain or remote low back pain consultation in place, because many people that come to see me, be it face to face or online, this is the first place that they need to go, because if they want to start doing exercises, if they want to start doing stretches, or if I want to start recommending them, I have to know what's causing it, because that's going to direct what stretches, what exercises, what everyday movements I'm going to recommend. Hence why I said that in the introduction. The second thing we can start doing is balancing the core musculature. So you can see on the image on the right hand side of some sort of pole that is sticking up out of the ground, and then it's got guy wires coming off of it. What we are trying to do is balance those guy wires. So we aren't trying to have imbalances or slack within guy wires, because that's going to influence where that pole can lean to. Now, this is more so to do with when we are putting load through the spine, i.e. lifting, carrying something, we're pushing something away, we're pulling something towards us, whatever it might be. We need to balance the core musculature to hold the spine in place, to hold it in that stiffened upright position, so we can then move the shoulders and the hips around it, so we're not endangering or increasing risk of injury to the spine. Again, as I mentioned, everyday movement is slightly different because there is a much lower load on the spine, because we haven't got heavy weights in our hands or at our legs or whatever it might be. The next one is having adequate spine flexibility. Not everyone needs a hugely flexible spine. Some spines are more presupposed to be flexible than others. So you've got a genetic factor to it as well. So the design of the spine will, again, influence how flexible it can be and how flexible it needs to be and how tolerant it is to flexibility, if that makes sense. So again, it's understanding your spine and how it's made to be able to, in a sense, choose how much flexibility you need. So again, it's not just a blanket case of you need more flexibility in your spine to overcome your lower back pain. That just isn't the case. And the next thing is flexible hips and shoulders. So as I've mentioned before, with the balanced core musculature, we want the core musculature to hold the spine in place. What we are then doing is then allowing the hips and the shoulders to do what they are built to do, which is go through large range of movements. The hips and the shoulders are both ball and socket joints. They are both freely movable joints, and they have greater ranges of movement. So when we are talking about movement and movement training and having a healthy joint and a healthy body and healthy movement, that needs to be dictated by the hips and the shoulders. Obviously, having adequate flexibility to the spine is going to assist and help that, but we want flexible hips and shoulders to be the primary place for our movement. Hence why we have those flexible hips and shoulders, and then we just look at the makeup of it. They are ball and socket joints, they are known as freely movable joints, and they have greater ranges of movement. So if you just look at the design of how that is put together, it's saying that the hips and the shoulders want greater ranges of movement, hence stretch those if those are inflexible. The spine is known as a slightly movable joint, and if you look at the design of the spine, when you go to the lower vertebrae in the lumbar, they are known as load-bearing vertebrae because they're bigger and they have less range of movement throughout them. The higher up the spine you go, so as you move into the thoracic and the cervical spine, you then start to find greater ranges of movement as you go up. Hence the atlas and the axis at the top have the greatest range of movement because they are at the top. And then as you go down, it gradually becomes less and less and less. When you get to the vertebrae, they are known as load-bearing spine. So that is just understanding the in a sense the design of the spine. You can start to paint the picture of the spine wants to be stable and have a lesser range of movement than the hips and the shoulders. So hopefully that makes a little bit of sense. Hopefully it brings a little bit of logic and context to creating range of movement at the spine and spinal rotation and how you go about overcoming lower back pain. Hopefully it's given you a better understanding of your anatomy and why we are saying what we are saying throughout these tutorials. So many thanks for watching. Again, please do come along to social media. Please do check out the remote low back pain consultation and how I can help you overcome your lower back pain. So many thanks for watching. My name is Chris from Christopher Holt Training. I will speak to you in the next tutorial.